In this explainer video, we'll be looking at how migration and health in migrant countries of origin are interlinked. Specifically, we'll look at how migration affects health outcomes and healthcare access for those who stay behind. But before we get into that, we need to first be clear about what we mean by migration. Migration is the movement of a person from one place to another for the purpose of residing in the new place, so tourism is not migration. Migration can be of shorter distances or longer distances and periods of time. It can be within a country, which is called internal migration, or it can be across a country borders, which is called international migration. In this video, we will specifically look at healthcare access and health outcomes. Access to healthcare means having the timely use of personal health services to achieve the best health outcomes. This basically means being able to have medical care or medication when needed. According to the WHO, a health outcome is a change in the health status of an individual, group, or population which is attributable to a planned intervention or series of interventions, regardless of whether such an intervention was intended to change the health status. So, for example, in this case, the so-called intervention would be migration or the sending of remittances. So examples of health outcomes in the context of migration and remittances are things like having more healthy babies being born and mothers with fewer complications after birth, or better growth rates of children, or fewer health problems in general, and more. There are a number of ways that migration can affect health outcomes and access both positively and negatively. Some of the most important are via monetary remittances, knowledge transfer and increasing aspirations or demand for better services, as well as absence of a person or a caregiver. These effects can be both positive and negative and are very context specific. However, in general, we see more positive impacts than negative impacts of migration and remittances on healthcare access and outcomes. Additionally, if monetary remittances are sent actually matters. If there is migration without remittances when there are expectations of remittances, then this can make the situation worse. First, let's look specifically at the effects of monetary remittances before turning to migration in general. There are several ways in which remittances affect healthcare access and health outcomes. The first is having more available monetary resources in the household to put toward preventative health care. Also, being able to pay for health services and access to medicine when needed, as well as buying more and better quality food. Another way that remittances could affect health outcomes is that the additional money in the household could mean that children or other members of the household no longer need to work or no longer have to work in dangerous jobs that are detrimental to their health. The third mechanism through which remittances could affect health is through investment in education. Increased education is generally correlated with better health outcomes. Additionally, via education, the recipients can gain new information about better health practices. Remittances can also theoretically affect health negatively. If remittances are spent on excessive or worse quality food, this could lead to worse health outcomes. For instance, take the example of a mother abroad sending money back to her children. Perhaps the children now decide to buy more candy and eat more fast food because now they have the resources to do so, and perhaps also less parental oversight. This could decrease health outcomes. If remittances are not sent when they are expected, then we could see other negative outcomes due to lack of resources in the household that would make it more difficult to buy diverse and nutritious food and to get access to healthcare when needed. We can also look at the effect of migration, not taking into account remittances, but just looking at migration in its own right. Linkages that are sustained through migrant transnational networks allow migrants and their friends and families in the countries of origin to transfer not only money, but also knowledge, norms, and values that are referred to as social remittances. Social remittances have been found to have an impact on fertility levels, of origin countries because of the transfer of norms from migrants in low fertility destinations to their countries of origin, as well as the knowledge and use of contraception. Of the possible negative effects, as mentioned previously, a lack of parental or caregiver oversight could lead to worse nutritional outcomes or other outcomes linked to care for children and the elderly. The fact that a person is missing in the household could also lead to more pressure on members who stay behind that might manifest itself in poor health outcomes, especially mental health outcomes. The migration of individuals from households can not only have health effects on the originating household members who stay behind, but it can also have effects on other households in the community that don't have migrants. Additional expenditure on healthcare by migrant households affects both migrant and non-migrant households. For instance, better access to healthcare reduces the emergence and transmission of preventable diseases within the community. Remittances have been reported to be specifically used to increase healthcare expenditures, leading to greater access to private clinics and medicine in case of sickness, as well as improved health knowledge, which can have a spillover effect on the entire community. Additionally, because of migration, there can be raising expectations of health services coupled with additional resources. This demand can lead to a new supply of better healthcare. Effects, however, are not straightforward. There could be positive physical health outcomes and at the same time, negative mental health outcomes. There's also a time effect that we can take into account. For example, some research has found a positive short-term and medium-term impact, but no long-term impacts on outcomes. So the link between migration and health is not always straightforward. The overall picture shows that migration and remittances are important for improving health outcomes, particularly related to children as well as healthcare access. While there is much more that can be discussed here, I hope this video gave you some more insight into some of the basic linkages between migration and health in countries of origin for those who stay behind. Please be sure to leave your questions and comments and give this video a thumbs up if you found it helpful. If you're new here, don't forget to subscribe to the channel and hit that notification bell to never miss my channel's weekly videos. And see you next time.